بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي السلام عليكم ورحمة الله وبركاته. So Jazakallah khairan for attending, and inshallah today we'll be discussing about the fiqh of menstruation. So moving on, alhamdulillah. We've had our little introduction already, so moving on. So today, inshallah, we've got quite a lot to cover, and inshallah, we'll be going through it step by step. And for each section that we will be covering, inshallah, we will cover some case studies as well, which will help us to just recall what we have learnt, inshallah. So the first section that we'll be looking at today will be the types of bleeding that a woman experiences during her lifetime, which are namely hayd, istihada, and nifas. So looking at the terminology and what each of these things are. Then we'll go into a little bit more detail with regards to hayd itself, looking at the different categories of women, looking at the we have a lot of questions with regards to vaginal discharge, and then also looking at the categories of blood and the legal rulings of purity, and how to determine the beginning and ending of hayd, inshallah, as well. And then also a really important aspect of our topic today is going to be with regards to ada. What is an ada? I think this is seems like quite a new concept for a lot of women, in terms of how do I record my menstruation, how do I work out my habit, and how do I calculate, and I will also be looking with regards to how discussing a little bit about changes in our habit, and especially looking at the 10-15 rule, which is something which a lot of women are getting confused about with regards to applying it. So we're looking into that a little bit, and then just looking at some legal rulings with regards to when menstruation comes early and how we are going to be going about and determining whether we are on our menstruation. And then just lastly, we'll be focusing on some prohibitions, things that we are not allowed to do when we are on hayd and nifas, and also with regards to what can we do during istihada. So moving on, inshallah. So firstly, looking at the definitions, as I mentioned. So hayd, otherwise known as menstruation, the literal definition of hayd is to flow. Okay, so meaning that, for something to flow, and when it's concerning menstruation, we know that it's regarding the flow of menstrual blood at specific times. And this may be during the month. So some women may have a very irregular cycle, and they'll see a menstrual flow once a month. Some women may have a slightly longer cycle, and it might be a 1.5 month, and it will vary from woman to woman depending on what phase of life they are in, and how their bodies, the cycle has been set by Allah subhanahu wa ta'ala. It's something which is, a gift from Allah subhanahu wa ta'ala. It's something that we don't have under our control. And you'll see that, there are various women that will have various different cycles. As far as the legal definition is concerned, with regards to the Sharia definition of what hayd means and what menstruation means, when we are looking at it in the sense of impurity, meaning being in a state of impurity. So we have two definitions. We've got the state of impurity, which is taken into consideration in the Sharia. So this is a legal restriction to worship, meaning that when it comes to acts of ibadah, there are certain restrictions upon us, because as we know that a lot of our ibadah requires us to be in the state of purity. So for salah, we need to have wudu. For reciting of the Quran, when we are reciting, when we are touching the mushaf, and for a woman when she is on her menstruation, she's not even allowed to verbally recite the Quran. Likewise, with fasting, we need to be in the state of purity, entering the masjid, and also, in terms of having intimate relations with our husbands, we also need to be in a state of purity. So it is a legal restriction that is placed upon a woman when she is in that state of impurity. And then the other legal definition, the Sharia definition, is that of physical impurity, which is the actual blood which is flowing from the womb and exits out of the vagina, and whether it is legal blood, meaning that if it's so it could be actual blood, which is where you are actually bleeding and you are seeing a flow of blood, or there is legal blood, which is sometimes in some cases you are not actually seeing any physical bleeding coming out, but yet it is considered as your time of menstruation, which we are going to look into more detail. So for now, to know that we have something which is actual blood, actual bleeding, which is based on actual visually seeing bleeding coming out, and based on legal bleeding, which is sometimes not always you are actually physically bleeding. And we've mentioned without birth, because haid is when the bleeding is taking place without any conception or any pregnancy or any labor going through that process, without any of that. So this would just be the monthly bleeding that a woman will see. Okay. So then moving on to istihada, which is known as dysfunctional uterine bleeding. So we have usually a woman will have her cycle where she is bleeding. As we said, on average, it'll be a monthly bleed that a woman experience, but sometimes there are occasions where she will experience istihada, which is bleeding which is exiting from the vaginal area, but it's not actually originating from the womb. It may be a ruptured vein, and it could be some cysts that she has within her womb area, and that could be the cause of that particular bleeding. And as far as the Sharia definition is concerned, so the legal definition according to the Sharia is that it's blood which is not classified as haid or nifas. So any bleeding which doesn't fall under the category of haid or nifas is then going to be classified as istihada. It is considered an invalid blood, which is something which we'll go into more detail with regards to when we are discussing habits and how to calculate habits. It is a legal purity, meaning that although you may be physically seeing some blood exiting that particular area, but as it doesn't fall under the category of haid or nifas, you are legally known to be in a pure state, which the implications are that you are now able to pray your salah and pray your Quran. And istihada may be actual blood or it may be legal blood as well. So it may be that sometimes there is actual physical blood that you have seen and that is classified as istihada, but sometimes depending on the cycle and your habits, etc., it could be classified as legal blood. So legally classified as istihada, which we will be going into more detail with as we continue, inshallah. And then moving on to the last category, we have nifas, which is a postnatal bleeding. A literal definition is to give birth, because as we know that once a woman has given birth to a baby, that is when she will be experiencing the bleeding that will be coming out from the area. And legally, the Sharia definition is that blood which flows from the womb and exits from the vagina, which is the fardh dakhil, which we are also going to go into more detail shortly. Even if it is a legal blood, after most of the child is born and she had not given birth 6 months prior to this. So meaning that it's nifas bleeding is going to occur once the majority of the child is born. So a woman sometimes before she goes into actual labor itself, she may see some breakthrough bleeding, which is where her, the waters are ruptured. And so there may be a plug of bleeding that comes out before the actual baby is delivered. That is not going to be classified as a nifas. Once the majority of the baby has come out of the mother when she is in labor, any bleeding that ensues thereafter is now going to will fall within the category of nifas. So likewise, sometimes we have the question of women when they are bleeding during pregnancy, that again does not fall under the category of hayd or nifas because she's not going through the labor. And inshallah, we'll go into more details with regards to that as we go on. Okay. So moving on to our next section, inshallah, looking at the legal durations of the 3 types of bleeding that a woman experiences. So firstly, with hayd, the minimum duration which is required in order for a bleeding to be considered hayd is 3 days and 3 nights. So this is 72 hours in total. Okay, so from the first point of where she may see some spotting or some bleeding, and all the way until 72 hours. It's not necessary that she has to bleed continuously within those 72 hours. She may be experiencing some spotting throughout, or she may just see some at the beginning, and then she may just see some at the end. But if that bleeding from the beginning to the end falls within the 72 hours or above, then that is the minimum duration of hayd, and we will consider that to be hayd. Okay, anything below that is going to be considered as istihada. Okay, and the maximum duration, and this is according to Hanafi fiqh as well, and I'd like to mention that we are studying according to the Hanafi fiqh. So according to the Hanafi fiqh, the maximum duration that we have for hayd is 10 days and 10 nights, so a maximum duration of 240 hours. So any time between the 3 days and nights and so 72 hours and 240 hours, anything between that, whatever number of hours and minutes it may be, will all fall under the category of hayd. Anything which goes beyond 240 hours, we will fall under a different ruling. And anything which is under 72 hours will also fall under a different ruling, as we will explore as we slowly unpack all of the rulings. Now, for nifas, there is no minimum duration for how long a woman should bleed in order for it to be considered as nifas. So as soon as she gives birth, even if she's bleeding only for a moment or for a day, it will still be considered as nifas for her. There's no minimum requirement there. But the maximum duration that a woman can have is 40 days. So a total number of days will be 40 that she can bleed for, which will all be considered as nifas. And then we have istihada. And now for istihada, there is no minimum duration for a woman to bleed in order for it to be considered as istihada. So it may be that she only experiences she notices only spotting for one day or at one particular time, and there's no maximum duration either, meaning that a woman, she may experience quite a lot of continuous bleeding, as we do see in some cases, and there's no maximum duration there. Istihada can go on for quite a while depending on what the female is going through. Okay, so moving on, how do we determine when does menstruation and nifas begin? Okay, so in regards to menstruation, a young girl, so a female of at least 9 lunar years old, so she has to be a minimum of 9 lunar years old, or if we're looking at solar years, and 8 solar years, 8 months and 3 weeks old. So any young girl below this particular age who experiences spotting of any sort, or she may see colored discharge, which is quite common with young girls, then she is not considered as menstruating until she reaches this minimum age. And so if she has reached this minimum age of at least being 9 years old, then when the blood exits from the vaginal opening, so meaning the fardh dakhil, which inshallah I've got a little diagram that I'm going to go through with you in terms of how do we understand the female genitalia. So when the blood has exited from the fardh dakhil, which is the inner part of the vaginal opening, towards the labia minora, which is the fardh kharij, which is the outer part, or it comes parallel to its edges, meaning that If you imagine that if you had a cut and you were bleeding, sometimes the blood is such that it flows out of the cut and you can see quite clearly that it has gone over. And sometimes the blood, it's not flowing to that level where it's going to flow over, but you can see that it's come parallel to the edges. So in terms of haid, um, I know in terms of cuts, there's a different ruling, but in terms of haid, if the blood bleeding from the vaginal area comes parallel to the edges of the inner part of the vagina, then we are going to consider a woman to have started her menstruation. So if these two are met, meaning that a girl is at least 9 years old and the blood has exited from the inner part of the vaginal opening, then we are going to consider menstruation as started. Okay. And with regards to nifas, it will be that when the blood exits from the vaginal opening towards the labia minora, or it's parallel to the edges, just like we had with with the haid, but on the condition that more than half of the child is delivered. So sometimes a woman, even prior to actually giving birth to the child, she'll start bleeding, as I mentioned, and that is not going to be considered until we know that more than half of the child is delivered. So this condition is attached with the exiting of the blood, that more than half of the child should be delivered in order for her to be considered as now that nifas has begun for her. Okay. So moving on to a small case study here, just to recap what we have learned. So you can put your answers into the chat box. So here we've got a case study where Samiha has started her menstruation. In January, she bled for a total of 11 days. Are all 11 days considered as haid based on the discussion that we have just had with regards to minimum and maximums that we have mentioned? Excellent, mashallah. So we've got no. Okay, yes. So well done. Alhamdulillah, well remembered. So maximum number of days that she can have for her haid is 10. Remember we said that you can't have any more than 10 days to be considered as your haid. So then what are we going to classify day 11 as? Mashallah. Yeah, excellent. Okay, so day 11 is going to be considered as istihada because we cannot have more than 10 days for our period. Excellent, mashallah. Well done. Okay, moving on. So just uh, another little short exercise before we move on. That I would like you to identify which type of bleeding is being experienced here. So the first one we have is that Saima, she's had her period 10 days ago and she's now seeing some more bleeding. So 10 days ago, she was on her period and now she's seeing some more bleeding. What type of bleeding is she experiencing now? Excellent, mashallah. Well done. So she is experiencing istihada. Excellent. Well done. Okay. So the second one we have now is that Tahira, she gave birth to a baby girl a week ago and she is still bleeding. What type of bleeding is she experiencing? Excellent, mashallah. Well done. Yeah. So she is experiencing nifas. Well done. And Zahra, the last one we have Zahra, she's 8 years old and she saw some pink discharge at school. What kind of bleeding is she experiencing? Okay, so we have a mix of answers. Some are saying that she's experiencing haid. Some are saying she's experiencing istihada. The answer is that she is actually experiencing istihada because she is not old enough. Remember, the minimum criteria in terms of age was that she has to be 8 solar years, 8 months, and 3 weeks. Okay, so if she was 9 lunar years old, or if we're going with the solar years, so then 8 years and 8 months and 3 weeks, then we would have considered her this bleeding to be haid. But as she's younger, she's only 8 years old exactly. She is not old enough to experience haid, so this is going to be istihada in terms of Zahra. Okay, excellent. Well done. Jazakallahu khairan for your participation. Okay, well done, mashallah. So moving on now, we are now going to go into more detailed rulings with regards to menstruation. Okay, so the first aspect of the legal rulings that we are going to look at is in terms of categories of women. So when a woman is experiencing haid, according to the Sharia, we are able to categorize these women in order to ascertain, in order to understand their cycle of menstruation, their haid that they are going through, in order for a mufti or an abba to be able to ascertain the legal ruling of their bleeding. We need to be able to categorize a woman. So we have 5 categories of women. We have the mubtadi'ah. She is a beginner in menstruation. We have a mu'tada, who is a habitual woman. We have the mudilla, who is a woman who has forgotten her habit. We have the 4th category, which is a mutahayyira, which is confused about habit. And these 4 all sort of go hand in hand together. And then lastly, we have our last category, which is a Aisa. So Aisa, she is a menopausal woman. Okay, so now let's look at each of these in a little bit more detail. So moving on to the next slide. So starting from the top left-hand corner, we have the mubtadi'ah, which is a beginner in menstruation. So any girl who is experiencing menstruation for the first time, in her first period, she is going to be known as a mubtadi'ah because she's never experienced haid before. So that's why we've put her into this category. And the reason why we put her into this category is that if she now has issues with regards to her bleeding just continues onwards, or she various other scenarios come to mind, then if the mother or the daughter is going herself to ask for advice, she will say that I am a mubtadi'ah, which will in turn help the person that she is taking advice from to understand that she is a girl who has experienced her menstruation for the first time. So as we mentioned, she's a young girl who's going to be at least 9 lunar years old, or she's going to be 8 solar years and 8 months and 3 weeks old. And she is known as a mubtadi'ah because she has no established habit as yet. Okay, we say as yet because as she finishes her first menstrual cycle and she goes through her purity and begins her second menstrual cycle, she may very well and most likely fall into the second category that we are moving on to, which is the top right hand corner of a mu'tada, which is a habitual woman. So a woman who has experienced menstruation before, we can say a woman or a girl, so a young girl who has experienced menstruation before and has a habit in menstruation and or purity. So it may be that sometimes she only has a habit in terms of a haid, in terms of the number of days that she experiences her period for, or she may well have both, that she knows like in the example that Tahira, she has a menstruation habit of 7 days. So each month she bleeds for 7 days, and she has a purity habit of 21 days. Or she could be that she has a habit in menstruation. So in the second example, Saima, she has a menstruation habit of 8 days, but she does not have a valid habit for purity. And that could be due to her seeing some spotting in her purity, so that she's unable to ascertain a valid habit for purity. And we'll look at those in separately in more detail with regards to the categories of bleeding and the categories of purity as well. Okay, so we've covered the mu'tadi'ah, the mu'tada. Sometimes what happens is a woman, she becomes a bit confused about her habit, and this generally occurs when a woman has unfortunately not kept her records of her bleeding and her purity habits. So she becomes a little bit confused because she can't fully remember what her pattern of her cycle was in the previous months. So that's why we categorize her as a mutahayyira. So she can remember bits about her menstruation, but she's confused about when in the month maybe she would have menstruated, or she's confused about how many number of days and how many number of days in purity, etc. Then the fourth category we have, which is on the bottom left-hand corner, we have the mudilla, who has totally forgotten her habit. So she's forgotten her habit, whether it be in haid or whether it's in nifas. She cannot remember the number of days that she would menstruate for. She cannot remember the number of days that she would have pure. And she can't even remember that did I used to come on in the beginning of the month? Did I used to come on, at the beginning of the week, or come on a particular day? Some women, they know that on a particular day or a particular time of the month they are going to come on, but a mudilla, unfortunately, she's be somebody who has totally forgotten her habit. So in the example we have that Saima, she's forgotten to record her haid, and she can't remember when she used to start, or when she used to, or how long she used to bleed for. Now, based on each of these categories of women, when they have especially for a mu'tada, when things start going wrong, meaning that when you start seeing continuous bleeding, or when you start seeing bleeding out of what you would consider your normal time, this categorizing a woman into one of these categories is what helps us to be able to ascertain your cycle and be able to give you a legal ruling with regards to what your bleeding is. So that's why it's very important for us to be able to identify these. And some of you may have heard these terms, that have been mentioned if you've ever had to ask an expert with regards to your habits. Okay, so those four go hand in hand. And then moving on to the last category we have is that of the Aisa, which is a menopausal woman. A menopausal woman, the minimum age for a menopausal woman is 55 lunar years. And according to the solar years, we have 53 years and 4 months. So any woman before that, even though she may have a long period where she may not be bleeding, but she's under this particular age, and then she may experience bleeding again, she will not be classified as menopausal unless she has early menopause, which is due to the surgical removal of her ovaries or her uterus, in which case, obviously, the doctors will then confirm that she is in early menopause due to these procedures taking place. But generally, in the general understanding of a woman who has her ovaries and her uterus intact, menopause age is not going to be considered until it's the age of 55 lunar years. Okay, so moving on to some case studies, just to recap on what we have learned. So what I'm looking for is, I would like you to identify what category of woman these women are falling into. So the first case we have is that Tahira's last menstruation in January was 8 days of menstruation, followed by 21 days of purity, and then she had another 8 days of menstruation. So which category of the 5 that we have discussed does Tahira fall into? Okay, excellent. Well done, mashallah. So everybody is saying mu'tada. So everybody agrees that she's a mu'tada because she has a habit. She has 8 days where she menstruated. She has 21 days of purity, and then she has another 8 days of menstruation. So she has a cycle. She has a habit. Excellent. Okay, so the second one is that Saida, she thinks maybe her menstruation was 4 days or maybe 8 days. and she can't remember when in the month her menstruation used to occur. What category do we think she is under? Excellent, well done, mashallah. The correct one is mutahayyira. Yeah, mutahayyira. Now, remember the difference between a mutahayyira and a mudilla was a mudilla, she's totally forgotten anything in respect of any habit that she may have had. On the other hand, a mutahayyira, she has some inkling, so she knows, like in the case where Saida, she knows that it was maybe 4 days or maybe 8 days, but she can't remember when in the month, and she can't remember exactly the number of days. That's the difference between a mutahayyira and a mudilla, that a mudilla has totally forgotten and a mutahayyira is just slightly confused. Okay. The last one is that Farida, she has just given birth to her third child and her nifas has gone over 40 days. She didn't record how many days her nifas was with her previous two children. Okay, so what category do we think? Mashallah, everybody's already excellent, mashallah. Yeah, she's a mudilla. Okay, because now in this case, she's totally forgotten how many days her nifas was, and she can't remember anything. Excellent, well done, well remembered, alhamdulillah. Okay, so moving on now to the next aspect of what we look at when we are calculating our habits and when we are categorizing our bleeding. Okay, so we've looked at categorizing a woman as to what category she is going to fall under. Now we're looking at the blood itself, so the bleeding itself that we are experiencing, looking at categorizing it. And usually the bleeding will fall under one of three categories. We have something which is known as a dam sahi. Sahi meaning a valid blood. We have a dam fasid, which is an invalid blood that a woman may experience. And then we have dam hukmi, which is a legal bleeding that a woman will experience. And inshallah, we're going to go through each of these in more detail. Firstly, though, moving on, we look at the colors of blood, because this is something that a lot of women, experience some different kinds of blood. So moving on to the colors of blood on the next slide. So we have red, which is usually the color of blood that most women will experience when they're on the haid. Some women will experience very dark bleeding, which will be almost black. So black is also considered one of the colors of blood. We have maroon. So sometimes the scale goes between red, especially when you're first starting off with your bleeding. You'll see that some women will start with very red bleeding, and then depending on throughout the flow of the cycle, it'll go to a very dark color, so black, maybe maroon. And then as it's tapering off, you'll see that it will start tapering off to brown, and then yellow. And sometimes some women start with pink and mustardy discharge. So you see how the cycle goes as well, according to the cycle of how a woman will be experiencing bleeding. And then on occasion, some women do experience green as well. Okay. So according to the Sharia, all types of colors other than pure white are ruled as blood. So for haid, when we are looking at the types of bleeding, anything which is colored other than normal discharge, pure white, is going to be ruled as blood. And scientifically speaking as well, if you look into the books, you will notice that they do mention that regular discharge is a clear to off-white color. Anything other than that, there is cause for concern and considered as abnormal. So likewise, within the Sharia as well, we have all other colors of bleeding are going to be considered as haid. Okay, so moving on, just a quick case study with regards to whether we're going to consider this bleeding as haid or not. So Sumaya goes to the bathroom, and after relieving herself when she wipes, she sees mustard-colored discharge. Her menstruation is due to start today. is she going to consider this as her hayd? Okay, excellent. Well done. Yes, so she is going to consider this mustard colored discharge as her hayd, especially because she is due to start her hayd today. Okay, well done. Mashallah. Jazakallahu khairan. Tahira has been on her period for the last 6 days and saw nothing in the evening, so she took ghusl and she prayed her Isha Salah. The next morning after Fajr Salah, she sees light brown discharge. Is Tahira going to consider this light brown discharge as hayd, and does she need to take a ghusl again? Excellent, well done. Yes. So even though she had a portion of time where she saw nothing and she took her ghusl, but the next morning, because she now saw spotting again, it's still considered as her hayd continuing, and she will also need to take a ghusl again in order to become clean. Excellent. Well done. Jazakallah khairan. Okay, so moving on, before we go on to discussing looking at the blood, etc., now I'd like to go through what is vaginal discharge. Okay, because this is a very important topic, and I know that the sisters have a lot of questions with regards to the vaginal discharge. I've just noticed somebody saying is that the voice is disconnecting. Is that for everybody, or is everybody able to hear clearly, inshallah? Okay, alhamdulillah. Okay, so looking at vaginal discharge which is clear or milky whitish is normal, and this is the discharge that most women and girls will experience. So on the whole, most women will experience some sort of vaginal discharge. It will either be clear or it will be milky whitish, and this changes based on the woman's cycle that she is going through. So after a woman has experienced her hayd, her menstruation, she might find that for a few days she actually has a period of time which is known as an infertile time after she's had her hayd. And within that time, she won't actually experience much discharge. So she may have, and it varies based on a woman's cycle. So if a woman has a 28-day cycle, for example, this dry period may be for maybe 4 to maybe 7 up to 7 days. For some women, if their cycle is shorter, where they may be experiencing just 21 days between, the infertile time will be slightly less. So it might only be up to 3 days where she's not experiencing much discharge. Then most women will go through a cycle, a phase in their cycle, which becomes a fertile time within the cycle. And within that period, which is, again, it varies based on a woman's cycle, but for some, it may be up to a week or maybe slightly more. They will experience a lot of discharge within that time, because this is the time where the your a female's body is its most fertile, meaning that it's getting ready to be able to conceive a child, so that when the sperm enters, that it makes it easier for it to be able to then reach the womb and for conception to take place. So that will be a time when a woman will experience a lot of discharge. And then we get into the third stage of a woman's cycle, which becomes the sort of later infertile time, which again is where now, if conception hasn't taken place, the body is now getting ready to then remove the lining of the womb where it got ready for conception to take place. And then that's when a woman will experience her hayd. Okay, so all women will go through some sort of this cycle where it's fertile and infertile, and based on that is how they will experience the vaginal discharge. So vaginal discharge, it's a fluid, or it's a mucus, or otherwise known as cervical secretions. They keep the vagina clean, moist, and they protect it from infection. Okay. So other than the obviously the advantage of the fertility aspect, which I mentioned to you, that the phases that it goes through, it's a really important job of the secretion to keep the vaginal area clean. It's like a cleaning mechanism. It keeps it moist. And it protects it from infection, meaning stopping bacteria from growing up into the womb area. Okay. And so any discharge, as I mentioned earlier as well, is that which is discolored is also scientifically considered abnormal too, meaning that not only does the Sharia take into consideration the different colors, but even scientifically, if you were to experience, let's say, green discharge and you were to visit your GP, they would also want to do more tests in order to ascertain what is going on in terms of your body, because it may be that you have an infection that needs to be treated, etc. As well. Okay, so that's really important for us to know that, you know, it is a normal discharge is a normal part of a woman's cycle. It does vary from woman to woman how much she does experience. It does vary from on based on the cycle the that your body is going through as to how much you will also experience. So moving on to just a little bit more of a detailed slide. So now discussing the Sharia perspective on discharge. So we've discussed that, you know, it's normal, it's absolutely normal for a woman to experience discharge. So discharge which is produced outside of the vagina in the vulva area, so the outer part of the vaginal area, which was the labia minora and the labia majora, which is the outer folds of the skin, that moisture is likened to sweat. So according to the Sharia, they've likened this moisture to sweat. So just how we perspire in our armpits, you know, it's like that. But there is a difference in opinion as to whether it is considered pure or not. Okay, so there is some fuqaha say that it is considered pure, some say that it is not considered pure. So there is that difference of opinion with regards to that. Then we have the regular discharge, which is produced in the inner part of the vagina. Okay, and this is usually clear, white, and not discolored. And this, when we're talking about usually, we're talking about it during a woman's purity part of her cycle. It will be clear, white, and it's not going to be discolored. And remember, I mentioned that it could either be clear or it could be off-white color. Now, as far as this discharge is concerned, there is a difference in opinion whether it is considered pure or not. If it is discolored, then all of the fuqaha are in agreement that it is going to be considered impure and that it is going to nullify the wudu. So if it's any other color than the usual clear or off-white color, then it is going to be considered impure and it is going to nullify the wudu. Okay. And then the last type of discharge which a woman experiences is going to be that discharge which exits beyond the vagina from the cervix when a woman is particularly ovulating. So remember that fertile time that I mentioned, when a woman is ovulating and there'll be an increase in the discharge. So during that particular time, we know that the discharge is actually coming from the cervix area because the cervix is getting ready for the conception phase. And so when this discharge it comes out, this is considered impure by all fuqaha and will invalidate the wudu. So we know that it's definitely going to invalidate the wudu if it is coming from that cervix area. Okay. So moving on to the question then. So we've discussed the, we've discussed all of the Sharia rulings. Does the vaginal discharge break the wudu? Okay, which is a very common question that most women have. So as you know, that the default ruling is that anything which exits the private parts is considered impure and thereby is going to nullify wudu. So just like how a person would go to the bathroom to relieve themselves of urine or stool, when that exits, that is going to nullify your wudu. Likewise, if the discharge is going to come out, we are going to say that it is going to nullify the wudu. Although we've gone into the discussion with regards to the three different types of discharge that a woman is experiencing through her cycle, it's very, very difficult for us to verify where the discharge is exiting from. Okay, so it's hard to determine that is this discharge just the outer discharge, has it come out from the exit, and due to this element of doubt as to where it's actually exiting from, the most cautious approach in this regard would be that we would consider that discharge has nullified a person's wudu and that they would need to repeat the wudu. Okay, so meaning that if you had made wudu, let's say for Zuhr Salah time, and you know that you were trying to keep your wudu for Asr Salah time, but you know that discharge has come out, then it is going to nullify your wudu and you would need to repeat your wudu for Asr Salah time. Okay, this is a most cautious approach. I know then obviously there will be some women who will have uh, personal circumstances with related to work, etc. That is looked at on an individual basis. But overall, we're saying that the cautious approach should be taken. And on the whole, I think for the majority of us, Alhamdulillah, it's easier for us to be able to redo our wudu and pray our salah. And in that, inshallah, Allah subhanahu wa ta'ala will reward us in that cautious approach, because we know as well within our hearts that we are in 100% state of purity by redoing our wudu and praying our salah in the most purest form, inshallah. Okay, so just moving on to the case study. Tahira was praying salah and felt like discharge was coming out. After completing her salah, she went to the bathroom to check and saw that a thick yellow discharge had come out. What is the ruling of her wudu? And what would be the ruling of her salah? Excellent. Okay. Yes. So because she knew and she felt the discharge was coming out during her salah, and then when she went to check, then her wudu is going to be considered as nullified, and she would need to repeat the salah again. Okay. Excellent. Well done. Jazakallahu khairan for your participation. Okay. So moving on now, going back to the categories of okay, so there's a excellent question here that let's read it out. That what advice would you give to a woman who constantly has discharge? Okay, so a woman who constantly has discharge, one method that could be used, especially for girls who are out at college or out at work, would be that when you make your wudu, you can put a kursuf, um, which is a piece of you would say a piece of cloth, but the alternative that we would use would be tissue, so toilet paper. What you would do is you would fold the toilet paper into a square. So imagine if you've got one sheet of toilet paper, fold it in half and then fold it in half again into quarters. Then you would place that at the opening or the vaginal opening. Okay. And that way you are stopping the discharge from coming out of the inner vagina area. And as long as the discharge doesn't come out of that inner vaginal area, then your wudu will stay intact. Okay. And so um, that would be one way of stopping the discharge from coming out and in order to keep your wudu. Okay. For instance, discharge every hour, then can they follow a lenient opinion or apply the ruling of a ma'zur? Please explain. Okay, so if they are experiencing discharge every hour, So they could adopt the method that I mentioned with regards to using a kursuf to stop the actual discharge from coming out of the vaginal opening. We don't advise, especially for girls who are not married, it's makruh for them to actually insert anything in. But for a married woman, she can slightly insert the tissue into the vaginal area, so that it stops any of the discharge from coming out, and it, stopping the wudu from becoming nullified. Or if they are suffering from discharge, and as the sisters just mentioned, that what if the tissue causes irritation and thrush, and they are, experiencing discharge a lot, and by blocking it, it's going to cause them irritation, then they may follow the lenient opinion of, I would say, that the discharge is not going to nullify the wudu, but again, you would need to sort of get to know your cycle as well. So I would say that if it is during the cycle, portion of your cycle where it's an infertile time, meaning the time when we know that discharge is just a regular discharge, which you are experiencing after finishing your haid up until where your fertile time is occurring, and any time which is beyond the fertile time, then you would say that you can follow the opinion that this is not breaking your wudu. But during that time where you are ovulating, and quite a lot of women, they do know that they are ovulating, because some women experience stomach cramps when they are ovulating. Some women notice the change within the discharge itself, that during ovulation is actually very clear. It's almost like a very runny, egg whitey type of discharge that a woman may experience. That would definitely nullify the wudu, because uh, that is from the cervix area. So in during those days, it would probably be better to block. But during the days where it's coming from the other areas where there is a difference in opinion, they can a person who is experiencing a lot of discharge can take the lenient opinion, to um, consider as not have nullified the wudu. Okay. There's some really good questions here, so I'm just going to read out a few. Yes, you can use the cotton or reusable cotton pads. Use the cotton pads which are not fibrous, because obviously you don't want any of the, the cotton wool type. You don't want the fibers going up. Not necessarily fresh wudu for every salah, because sometimes fresh wudu for every salah is only for a ma'zur, person who falls into the ma'zur category. Sometimes a woman is experiencing a lot of discharge, but she doesn't fall under the ma'zur category. So for her, it will just be whenever she knows that the discharge has come out, then she will obviously read to her wudu. Then must you perform istinja? Is that the question to ask when your discharge has come out? Yes, you would wash away or wipe it away and make sure that you are clean, and then you would then remake your wudu. Okay. Let's have a look. What is the criteria for a ma'zur category? A criteria for ma'zur is that a person is experiencing this difficulty for one entire salah time. So let's take the example of Zohar salah time starts at 1 p.m. Asr salah time is starting at 3 p.m. During 1 p.m. and 3 p.m., there is absolutely no time within which the person can make the wudu, and pray their salah without the difficulty occurring. So let's say a woman is experiencing discharge to the extent that she's just wiping, and it just keeps coming out. Even if she makes wudu, she knows that discharge has already come out, or she may get chance to make wudu, but by the time she starts praying her salah, she knows that she is already discharged. So if that entire time is taken up with that difficulty, then the person will fall under the category of a ma'zur, and then the rule of ma'zur will start, that will apply, meaning that whenever that difficulty occurs, then the wudu will not be nullified within the next salah time, and they can continue to pray Quran, salah, etc. And then at the start of the next salah time, they would remake the wudu. But generally, for most women, they don't fall under that category of ma'zur, so they can adopt, the blocking method if that is suitable for them. For those that it irritates them, obviously, as I mentioned, then they can take the lenient opinion if they're not falling under the category of ma'zur, and they are really struggling with it. Okay. Let's just do one last question and then we'll take a small break. So during ovulation time, if the tissue is kept there to hold the discharge, would the wudu still be valid? Yes, as long as it doesn't come out, the wudu would still be valid. Okay. Time between Maghrib and Isha is 1 hour. Can 1 hour be used to identify whether you're a ma'zur? Yes. Yeah, absolutely you can. Once you take out the tissue from blocking, do you need to redo the wudu? Yes. So if you have put tissue and you remove the tissue and there's discharge on there, then when it comes out, your wudu has broken. So you would need to redo the wudu. Okay? Okay, so inshallah, we'll continue. I've just noticed in the chat box there's a quite an important question, which I just want to read out, and I want everybody to keep in mind, inshallah, because as we follow on with regards to the categories of blood and start looking at habits, inshallah, everything is going to fall into place. So the question is asking that how do you tell you're going to be on your period if you have PCOS? Okay, so that is a very important question, alhamdulillah. And inshallah, keeping that in mind, we're going to go through the categories of bleeding and then with regards to purity. And as we discuss have our little discussion with regards to habit, inshallah, we're going to gradually answer that question. Okay. So specifically looking at the categories of blood. So we mentioned earlier that we have 3 categories of blood. We have dam sahi, which is a valid blood. So now we're going to look at each of those in more detail. So a dam sahi is that bleeding which is 3 days or more. Okay, so 72 hours plus anything which is 72 hours or more than that is going to be classified as a dam sahi, but it has to be 3 days or more and less than or equal to 10 days. Okay, so this is now we're looking at the range of time for a bleeding to be now considered as a valid blood. So if a woman sees blood for 3 days or more and equal to or less than 10 days, then that bleeding within that range is going to be classified as dam sahi. Now, this bleeding can be legal or actual blood, meaning that sometimes, and we had one of the case studies where a woman, she might experience a few hours or half a day where she doesn't see any actual physical bleeding, but thereafter she sees some more bleeding. So that is going to be considered as legal blood because the entire time within that range, so within the 3 days or more and equal to 10 days or less, within that range, all of that is going to be considered as dam sahi. So it might be that the entire time she sees physical bleeding the entire time, or sometimes she might have a slight break for a few hours or half a day where she doesn't see bleeding, but that is all going to be considered as legal bleeding as well because we categorize it together. Now, an important aspect we need to remember here in terms of habit is that a valid blood may be used as a habit. So if a woman has this valid bleeding that she's seen, then we can use this as a habit. Okay. Then we have the second category, which is the opposite to a dam sahi, a valid blood, which is a dam fasid. This is now an invalid blood because it's going to be the opposite of what a dam sahi is. So it's going to be any blood which is other than that which is valid. So meaning that it might be less than 3 days. So it's less than 72 hours she's seen bleeding, or she's seen bleeding which has gone beyond 10 days. Um, so, now we're going to have to look at whether we can use this as a, what we're going to categorize the bleeding as, whether we can use it as a habit, etc. But a dam fasid is the opposite of a valid blood. Okay. And an invalid blood cannot be used as a habit. Okay. Uh, Good question in chat box, that when she sees blood on the first day, should she consider this as haid, or do we need to wait to see if it is continuous for 3 days or more? We are going to be looking at that question, and we're going to answer that question as we go along. Inshallah, it's all going to fit into place. So here now we're just talking about how to identify, and inshallah slowly we'll get to gradually answering your questions that you have put in the chat box, inshallah. So for now, understand that a dam sahih is something which is 3 days or more and equal to or less than 10 days. And anything other than that is going to be classified as a dam fasid. Now we have this third category, which is known as legal blood, dam hukmi. And these are days which are considered menstruation even though there is no physical actual bleeding within them. So meaning that, how I mentioned earlier, that if, for example, a woman, she starts bleeding, she bleeds for 4 days, then on day 5, she might not see anything for the next 12 hours. But after that, she now sees more bleeding again. That 12 hours in between is going to be also considered as dam hukmi, meaning that legally it's going to be classified as blood because it's sandwiched between the bleeding before and the bleeding afterwards. So we are going to consider that as her bleeding days as well. Okay, so that's understanding the 3 different types of blood. Okay, so if yes, that is a bit like tohr mutakhallal. Okay, mashallah. So some of you know the terms already. So moving on to the case studies, just see if we can practically apply what we have learned. So here we've got a log for Tahira's menstruation that she saw in January 2023. So as you can see that on the calendar, she has marked Monday the 16th of January, and she's bled all the way until Sunday the 22nd of January. What category of blood are we going to put this under based on the categories that we've just discussed? Excellent, mashallah. Yes, so dam sahi. This is a dam sahi, a valid blood, because we know that it's more than 3 days, because we can see that it's gone all the way up until the 22nd, and it's less than 10 days. So that's why this is now a valid blood. MashaAllah, well done. Okay, moving on to the next case study. Okay, so case study 2 is we've got Saima's log here for her menstruation that she saw in 2023, in January 2023. She's bled now from the 16th. So as you can see on the calendar, she's got a red dot on the 16th, a red dot on the 17th, and then she sees nothing on the 18th and 19th. And then she's got bleeding again on the 20th, 21st, 22nd, and nothing on the 23rd, and then again on the 24th and 25th. What kind of blood bleeding has she experienced? So the 18th and 19th and the 23rd are dam hukmi. Excellent, because we including these days even though she hasn't seen any bleeding within them, within her habit, and we are saying a dam sahi because she has seen less than 10 days of bleeding. Okay, mashallah. Okay, yes, excellent, well done. Jazakumullah khairan for all of your participation. So as you see, from the 16th to the 17th, and inshallah we're going to look at how to calculate, but you can see that 1, 2, 3, 4, 5, 6 up to the 22nd, sorry, 7th on the 23rd, 8th on the 24th, and 9th day on the 25th. This is now a dam sahi with dam hukmi within it, which is on the 18th and 19th, where she hasn't actually seen any bleeding, but we are including it in the blood. Excellent. Mashallah, well done. And just one more case study. So case study number 3, moving on. So Tahira usually has a menstruation habit of 7 days. In January 2023, she bled for a total of 11 days. So if you have a look on here, she's bled from the 14th all the way to the 25th, which comes up to 11 days. But she's got this one day here, 23rd, where she didn't see anything. Is she going to count the 23rd as part of her bleeding? This is the first part of the question. What category of blood is this? And can she use this as her new habit? Okay, so let's break this down. Does she count the 23rd as part of her bleeding? Yes, yes or no? Okay, when we're looking at habits overall, we do include the 23rd within the entire thing. So this 23rd is a dam hukmi because we have to look at the entire bleeding itself. So some of you have said no, but yes, we do include the 23rd within the entire chunk of bleeding. Okay. Now we know that she has a habit of 7 days, and this time she's bled for a total of 11 days. So what category of blood is this going to fall under? Excellent. Okay. So dam fasid. So we are going to classify this as a dam fasid. Now, would she be able to next month use this 11 day as her new habit? No, she can't use this as her new habit. And I know some of you have made mention to referring back to her habit, etc. But just for the sake of recapping what we've done, because we're slowly building on the knowledge, for now, we are going to say that what she's experienced in the month of January is a dam fasid because it's gone beyond 10 days. This 23rd is a dam hukmi, which we are including within all of this bleeding. Okay. And if next month she would not be able to, this, because it's a dam fasid, she can't use it to establish a habit. Okay. That's the part that we want to focus on for now. Okay. So I know some of you have made mention with regards to referring back to her 7 days habit, and inshallah we're building on that as we go through the slides. But has everybody understood this when we're looking at it as a whole picture in terms of what we're going to categorize it? Okay. Alhamdulillah. Okay, well done. So basically she still has a 7-day habit. Yes. Okay. Okay, I'll just briefly explain it again. So when we are looking at somebody's habit, so she's marked her bleeding from the 14th to the 25th. Right now, we don't need to worry ourselves as to where she was supposed to be bleeding, etc. But just looking at the wholesome picture to try and figure out what kind of bleeding she's experienced in January. So from the 14th to the 25th, we had this 1-day gap in between, which was the 23rd. And even though we're saying that it's the 20, there's no physical bleeding in there, we are including that day as a dam hukmi within all of this chunk of bleeding. Okay, so yes, we are including the 23rd as part of a bleeding. What category of blood is this falling under? Well, we know that it's gone over 10 days. So based on categorization of bleeding, this is now a dam fasid. And as it is a dam fasid, in future, she cannot use this month to establish a new habit because it is a dam fasid. Okay. No, her period didn't end on the 23rd. Okay. We'll look at the habits in a moment. Okay. But has everybody understood how to categorize the bleeding? Ji, Alhamdulillah. So you understand now. Alhamdulillah. Okay. So moving on to now understanding the legal rulings on purity. Okay, so we've understood the basic rulings with regards to bleeding. Now we're going to look at the legal rulings of a purity, and then we're going to combine all of the knowledge that we've put together and discuss habits. So moving on to my little chart on categories of tuhur. So just how we had the categories of bleeding and we had the categories of women, we also look into consideration on the categories of tuhur. So meaning that a purity that a woman experiences, we have to be able to put that into a category as well. Okay, so if my little chart here, we can see that categories of tuhur are two. We've got two subcategories. We have something which is known as a tuhur tam, which is a complete purity, and then secondly we have a tuhur naqis, which is an incomplete purity. Okay, and out of tuhur tam, excuse me, a complete purity, we have two subcategories. We now have a tuhur sahih and we have a tuhur fasid. So meaning that it may be a complete purity, but it may be a valid purity, or it may be a complete purity, but we are going to consider it as a invalid purity. Okay. So now moving on to the next slide, we're going to have a little bit more detail with regards to what is the difference between these. Okay. So firstly, looking at the difference between the complete purity versus the incomplete purity. So a complete purity is going to be one which is 15 days or more. So meaning that when your menstruation ended, from that moment all the way for at least 15 days, or if not more, you have had a complete purity. You've had no spotting, no colored discharge whatsoever, no bleeding, and it's been clean. And this purity can either be valid or invalid. As I mentioned in the previous slide, that we have two subcategories that come out from there. It can be valid or invalid, which I'm going to explain in more detail soon. And a complete purity of 15 or more days may separate the two bloods on either sides, in which case each will have its own ruling. Now here I want to highlight the word may, because this is where a lot of women get confused with regards to the 10-15 rule, which I'm going to discuss as well in the coming slides. Okay, so that's why it may separate the two bloods, but other varying factors need to be taken into consideration as to whether we are going to consider it as a valid or invalid purity. Okay, but for now, to know that the complete purity is one which is 15 days or more, and there's no bleeding within it. Okay, and in comparison to an incomplete purity is one which is less than 15 days, and an incomplete purity is always invalid. So that's why we never had the subcategories coming out from there. Incomplete purity is always going to be invalid, and an incomplete purity cannot be used to establish a haid habit. Okay, so that's the difference between the two. Okay, so then moving on to understand, I have an example here of complete purity and incomplete purity. Okay, so here we've got in January 2023, a woman has seen bleeding from the first Sunday, the 1st of January. She's bled for until the 6th of January, which is a total of 5 days. After this 6th of January, you'll see that she's had all of these days. So from the 7th, 8th, all the way to the 26th, and she started again on the 27th. She's had a complete purity of no bleeding, no spotting, anything. And then she started again on the 27th. So this from here, from the 7th to the 26th, based on her cycle being this, is considered her complete purity. Okay. Now here, on this calendar in the right hand corner, February 2023, a woman's finished her period on the 1st of February. Okay, let's imagine that this was a continuation from January into February. So she bled from the 27th all the way to the 1st of February. She then, her period ended, she took her ghusl. Now from the 2nd, she was clear all the way until the 12th. And then on the 12th and the 13th, she now has seen some bleeding. But as you'll notice that from the 1st, we only have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 days pure. So from the when she ended on the 1st all the way until when she started on the 12th, there's only a total of 11 days between each bleeding. So therefore, from the 2nd to the 12th, that purity is going to be considered a incomplete purity because it is less than 15 days. Okay, so I hope that's clear there, inshallah, by use of the calendars, inshallah, to highlight that for you. Okay, alhamdulillah. So moving on to the next slide. So remember we mentioned on the chart that we had a valid purity versus an invalid purity. Okay, so we had our complete purity first. Our categories were complete purity and incomplete purity, and then from complete purity we had the valid purity and invalid purity. Okay, so Tohar Sahih is a valid purity which is not less than 15 days. It doesn't have istihada mixed with it at the beginning, middle, or the end, and is between two valid bloods. Okay. Now, when it talks about two valid bloods, remember we said that a valid blood was a bleeding that was between 3 to 10 days. And so that was a dam sahi. So meaning that her period before the purity that she's experiencing and the period that she's experience after that purity are both valid bleedings. So that is now going to be considered a valid purity. A valid purity can be used to establish a habit because we know that there's no istihada in between. Okay. On the other hand, a Dohar Sahih but with an invalid purity is a purity that is less than 15 days, is mixed with istihada blood at the beginning, middle, or the end, and is in between two invalid bloods or one valid and the other invalid blood. Okay, so meaning that she's finished her period. Let's say her first period in January was a valid one. It was between 3 to 10 days. There was no istihada going over. Then she started her purity, but in that purity, it was now less than 15 days. So she started bleeding again. And then the period that she experiences afterwards is also invalid because it goes over, let's say it went over 10 days. So that purity within those two bleedings is going to be now considered an invalid purity because of the she's not experienced 15 days or more of purity in between. Okay. Does 15 days of purity count from the time you do ghusl? Yes, 15 days of purity will count from the time that you do ghusl. And that's why when we're calculating, I'm going to show you how we do the calculations of it's not per day, it's per 24 hours. So inshallah, I'll be showing that on the coming slides. Okay, so if we move on to case study 4, moving on. Okay, so looking at case study 4, we've got Tahira. She only bled for 4 days in January, and then she saw bleeding again on the 20th of January. Okay, so she bled for 4 days from the 2nd to the 6th, and then she saw bleeding again on the 20th of January. What kind of purity has she experienced? So what kind of purity has she experienced? Invalid. Yeah, excellent. Okay, because it's a fasid, meaning that it's invalid purity because it is less than 15 days. Okay. Okay, excellent. Jazakallah khairan. Okay, moving on to the next case study. So Saima has a habit of 6 days in menstruation and 18 days in purity. What kind of purity has she experienced? So she's bled from the 2nd to the 8th, and this is a habit. So this is a habit in menstruation, and these are her 18 days of purity as per her habit. Then what kind of purity has she experienced? So this is a tuhri sahi. Excellent. Okay. So this is a tuhri sahi, complete tuhar and tuhri sahi that she has used. And can she use this as a habit? Can she continue to use this as a habit? Yes, she can. Yes, she can use that as her habit. She could continue to use that going forward. Okay. Okay, so moving on, now discussing Ada. So I think, Alhamdulillah, we're building on this slowly, and some of you have already mentioned some concepts with regards to a habit, and now we're going to apply all of these together. So now we're going to apply the dam sahi, the categories of blood. We're also going to apply the categories with regards to tohar together, and we'll also be touching on the mainly looking at the mubtadi'a and mu'tada, okay, within our discussions when we are talking about habits. So moving on to the next slide. Now, what is a habit in menstruation and purity? Okay, so a habit, or some women like to call it a cycle. Um, a habit or a cycle in menstruation and purity is a usual number of days that a woman will see in her menstruation. So, some women will see regularly between 7 days, 7 to 8 days of haid. It's a regular amount of bleeding that a woman may bleed in her nifas. If you've had multiple children, like Alhamdulillah, I've had 5. I've seen that Alhamdulillah, I had a habit in my nifas. And you can use that only once. I can say it probably went over, but then Alhamdulillah, because I had recorded previous nifas, I was able to work it out. So you do see a habit or a cycle forming in terms of nifas as well. And then the number of pure days between 2 menstruations is also your habit in purity. So there you've got the 3, because you've got a habit in hayd, you've got a habit in nifas, and you've got a habit in purity as well. Okay, so menstruation and purity example is that a woman, she bleeds for 7 days, followed by a valid purity of 18 days. And so then her habit is going to be considered 7 days, and her habit for purity will be considered as 18 days. Okay. And an example for nifas is that of a woman, she had bleeding for 30 days after her first child. So remember that the habit is established with the first valid bleeding and valid purity. So in the case of the menstruation, her first menstruation, even if it was a mubtadi'ah, she had a valid hayd of 7 days. She had a valid purity of 18 days. That's now her established habit. So likewise, a woman, when she first has her child, gives birth to her first child, if she bleeds for 30 days after childbirth, and then after that she has, let's say, for example, 25 days of purity, she knows now that my nifas habit was 30 days. And then after that, I experienced 25 days of purity. Okay, so that would be how a habit is established. Now, and it doesn't have to be, the previous valid habit is what we are going to use as your established habit. Okay, so moving on in regards to, and I know lots of people probably have this question with regards to fluctuation in cycle. So what is a fluctuation in cycle? Fluctuation in cycle is where a woman will see sometimes a slightly shorter menstruation or a slightly longer menstruation. So most women will have a regular habit, and but sometimes we do see the slight fluctuations in them as well. Okay, within the legal limits, and when I say legal limits, I'm talking about the legal limits of a dam sahih and a tuhur sahih. So dam sahih was between 3 to 10 days, and a tuhur sahih was 15 days or more. Within that legal limit, if there's slight fluctuations, that is fine. That is not a problem. Okay. So in the example that a woman saw 7 days of bleeding in the month of January, and then the following month, in the month of February, she sees 8 days, and that slight fluctuation is fine. That's normal. That happens to most women. Okay. So the number of menstruation days will be considered her new habit. So if in January it was 7, and in February she saw 8, and if things start going wrong, excuse me, in March, then she can refer back to her last valid haid, which was in February of 8 days, as long as obviously the purity was valid and etc. Then she's got something to calculate upon. Okay. So don't worry about slight fluctuations that are taking place. Okay. So moving on to how do we record a habit? Okay, because I feel like before we even start discussing habits, etc., it's really important to understand how we should be recording our habit. So when we are recording our habits, it's down to personal preference. Some people would prefer to have a physical diary where they are actually circling the days of their haid. Some, now, alhamdulillah, everybody has a mobile phone. There are apps that we can use. P-Tracker is one which is really good. And you can record on there not only the days that you're bleeding, but you can add additional notes of time, etc. But when you're recording, whichever method you are using, whether you are using a pen and paper or whether you are using an app, you must record the day that you start bleeding, the date that you started bleeding, and the time that you started bleeding as well. Okay. So for example, if somebody is started their period today, let's say at 3 p.m., she would put down 26th of February, you know, Sunday. So Sunday, the 26th of February, she would write down the time, 3 p.m. And she could even record the color. So she might put pink discharge noticed. So she would do that for her menstruation or her nifas. And when you finish your menstruation or your nifas, again, you will write the same down. So for example, if you finished at 9 p.m. in the evening, and let's just pick a date. Let's say it was last night. So Saturday, the 25th of February, at 9 p.m., you would put down saw clear discharge, and then did your ghusl. And then you might also want to, put down whether you prayed your salah or not, or whether, those kind of things as well. Okay. But as well as that, so as well as the start and finishing of your menstruation and your nifas, any other time you see spotting other than clear discharge, you must record it. Okay. And this is really, really important, especially when things start going wrong, because this is when the appas and the muftis will ask you with regards to your previous tohar, whether you saw any spotting in there, and as to whether they can use that to establish a habit for yourself. Okay. So if you see colored discharge, maybe just once in between the purity, write it down, the day, the date, the time, and what color you saw as well. Okay. So nifas is when you've had a child. After you've had a child, the bleeding that you would after you've had a child, the bleeding that you experience, that is what is nifas. Okay, so I'm just going to have a look through the questions because I've just missed a few. Apologies. If we bleed through our pregnancy, would we count from the day of childbirth, or would it be calculated differently? I'm assuming that your question is asking whether you're continuing classifying nifas from the day of the childbirth. Nifas is classified from when the childbirth actually takes place. Any bleeding that you experience throughout your pregnancy is considered as istihada, but you would just record it down as well. Okay. Somebody's mentioned the Pillar app and the Clue app. I'm not aware of those, but yeah, whatever apps you find useful, share those with each other. Would you also recommend nothing color also? Nothing color, yeah, so clear, or you would say you know, whitish discharge. But yeah, you would write down all the colors. Okay. How do you determine when you officially have stopped your period? Is it one salah time you see white or no discharge? Okay, so we're going to come to that. So keep hold of that question. Okay, right. So moving on to the next slide, inshallah. Okay, so how do we calculate our habit? Okay, so as I've mentioned before, that when you this problem really occurs when you're using apps, because the app is assuming that if I started my period at 3 p.m. today, that today is day one. They just calculate it as day one, regardless of what time you start. So this is why it's really important for you to put your time in your app as well. Okay, a full 24 hours is 1 day of your habit. So if I started at 3 p.m. today, 3 p.m. from now until, if you want to be really pedantic about it and say, well, 3 p.m. tomorrow's gone 1 minute over, but 2:59 p.m. tomorrow is when your 124-hour has passed, and that is 1 day. Okay, so that's why for us it's really important to be able to pinpoint it down to the minute as to whether that is one full day or not. Okay, so if, for example, if Tahira, she started her period on Monday 23rd of January at 12 p.m., day one will end at 12 p.m. So as I put in there in brackets, 11:59 a.m. on Tuesday 24th of January, and likewise she will continue to calculate her 24 hours. Okay, so if we're moving on to the next slide, I'll just show you that how we would go about this. So how do we record on a calendar? Okay, so here at the bottom, if you see that I have she started on the 23rd of January. She's written down, so we know Monday 23rd of January started at 12 p.m. Yes, this is in the afternoon. And so from here, from the 23rd to the 24th, when it reaches 12 p.m. there, we are going to consider her 24 hours of her habit. Okay. And likewise, when we are calculating our purity, and somebody mentioned in the chat box as well, that when you have finished your period, you will put down the time. So finished at 1:30 p.m. And you would then count from 1:30 p.m. from the 3rd all the way from the 4th until the 4th as your 24 hours. So that's why when we are calculating, you'll see that when I have calculated the days, I'm going from 23rd to 24th, which is 1 day, 24th to 25th, which is 2 days, and then to the 26th, which is 3, 4, 5, 6. So in reality, this lady has had a menstruation of 6 days and 10 hours. Now, if you were just to look at it on a calendar, you would say that 23rd, 24th, 25th, 26th, 27th, 28th, and 29th on paper looks like it is 7 days, when in actual fact it is 14 hours less than what we are viewing on paper. Okay, so that's how we would need to calculate it. So what I want to do actually is, if moving on to the next slide, I want you all to work out the next case study. So let's work out the habit. So Tahira's last menstruation ended on the 3rd of January at 1:30 p.m. after 7 full days. Her previous purity was 19 days and 24 hours. So you can see she's been pedantic and she's written down, date and time, etc. Her next menstruation started on the 23rd of January at 12 p.m. and finished on the 31st of January at 10 p.m. What is the purity between the two periods? So meaning that between when she ended on the 3rd of January at 1:30 p.m., what was the purity she experienced between there and the 23rd of January? And what is her habit in menstruation? Meaning based on the new amount of bleeding that she has just seen, what is her habit in menstruation? Okay. Let's have a look. While you do that, I'm just going to read through some of the questions. Let's have a look. Somebody's asking a question with regards to discharge, that if you do have to check for every salah if you have discharge, or is it if you're certain and you can feel the discharge? You don't need to check for every salah. If you felt it coming out, then you should go and check. But if you haven't felt anything coming out, then that is fine. You don't need to keep checking. After cesarean section, there is not too much bleeding. Irregular bleeding occurs. How do we calculate the days of nifas after the C-section? So for that, you would most likely experience some sort of bleeding, even though it's irregular. Remember, those legal days will fall into it as well. So you would need to go into that. Okay. Okay, the PCOS question. Okay, let's come back to that in a minute, inshallah. So purity days, if you have calculated it correctly, will be 19 days, 22 and a half hours. Okay, so some of you have pure 20 days, but remember we're looking at the hours and the minutes as well. So based on what she's mentioned, she finished at 1:30 p.m. after 7 full days. And her next menstruation was on the 23rd of January at 12 p.m. So remember, this is 1.5 hours. When she started, it's 1.5 hours less than the full 24 hours. So therefore, it's 19 days, 22 and a half hours. And then the menstruation habit we already covered was 6 days and 10 hours. Okay, excellent. Does the purity not start after her period stop, which is the 9th of January? In between the 9th and 23rd is 13 days. No, we said that her period had stopped on the 3rd of January. Okay. Okay, so moving on to the next slide. Okay, so now we're looking at changes in habit. So sometimes bleeding can occur earlier, or bleeding can occur later, or sometimes you get more number of bleeding days is more as well. Okay, so haid bleeding, we have to look at whether the bleeding is more than the previous month or whether it is less than the previous month. So for example, if a woman she has she bleeds for more than 10 days, her habit is usually 7 days, and she bleeds for more than 10 days, then the total number of bleeding days is 10 plus, meaning more than 10 days. Only the number of days in her habit is considered as hayd. Any extra days are going to be considered as istihada. So this was a question that some of you had earlier when we were doing some of the previous examples, that we mentioned that Tahira, she had a habit of 7 days of bleeding every month, and then the next month she bled for 11 days. So because she now has a habit to fall back on in terms of menstruation, only 7 days of those 11 days are going to be considered her hayd, and she would make qada of any salah that she's missed going forward from day 8, 9, 10, and 11. Okay, and those days would be considered as istihada. Okay, but if her bleeding in that particular month is total number of days is less than 10, then all the days are going to be considered as hayd. So in the example, remember that Tahira, the previous month, she menstruated for 7 days, but the following month she menstruated for 9. Now, because that is under 10 days, 9 days are going to be considered as her hayd. Okay. But in the case that sometimes a period, you would wait until istihada, you would wait until 10 days. If you know that it's gone 10 days and beyond now, that's when you would take your ghusl, then you would continue to pray your salah and then work out the qadars that you would need to based on your previous habit. Okay. But if you bleed less than the previous month, so say for example, Tahira has a habit of 8 days of bleeding from the previous month, but this month she's only bled for 6 days, she's going to make a ghusl because she thinks that she's finished now, so she'll make ghusl and she'll start praying her salah. Now, for her, what we would normally say as well is that she should take a precautionary ghusl at the end of the habit. So meaning that when her habit ends on the 8th day as well, she should take a ghusl then as well, just in case her bleeding returns later on and we have to resort back to her habit. Okay. And also one ruling with regards to intimacy with a husband is that although when she finishes earlier than normal, she makes her ghusl and she starts praying, she can pray her salah, she can pray Quran, she can keep her fasts if it is a month of Ramadan. The only thing she shouldn't do until the days of habit are over is that she should not have intimate relations with her husband, because there's a possibility that blood might return. And as you know, that it is prohibited. We're not allowed to have intimacy with our spouses during hayd. So therefore, you would avoid that until the habitual days have passed, and then thereafter you can have intimate relations. Okay, so moving on to the next slide. So change in habit when bleeding is more than the previous month. This is just an example to show, and which I've already discussed, that Tahira's usual habit is 7 days every month, and this time she's bled for 12 days. So the first 7 days we're going to consider her period, and the rest we're going to classify it as istihada. She has to wait for 10 days before she takes her ghusl and before she starts doing her qada, etc. Because it's all we look at it all in hindsight afterwards. We can't just assume that, okay, my habit is only 7 days, I'm still bleeding on day 9, I'm just going to take a ghusl and start praying, because you might stop and then all of that might be your hayd as well. So you have to wait until the 240 hours. Okay, next slide. Moving on. So likewise, change in habit of nifas will be calculated the same. So if a woman's bleeding stops within 40 days, then all of it is going to be considered her nifas, whether it was less and more than the previous habit, but because it's within, that is still her nifas. But if it exceeds 40 days, then she's going to go back to her previous habit. So let's say, for example, when she had her first child, she saw a nifas for 35 days. The second child, it went over 40 days. So now she'll resort back to her 35-day habit. So up to 35 days was her nifas. Anything beyond that will be considered as istihada, and she will make the qada of those days of her salah. But if it was her first child and she went over 40, then obviously we're going to consider 40 days as her habit. Okay. Moving on to the next slide, inshallah. So here's a quick case study that we've got. So Saima's usual habit is 8 days in period. This month, how many days has she bled, and what should she do once her bleeding has stopped? So if I could ask you all to calculate, let's just say that she started at 12 p.m. on the 5th and ended at 12 p.m. on the 11th. So how many days are we going to consider her period? She's got a 6-day period. Well done. Okay, so now what should she do once her bleeding has stopped? She should do ghusl. Okay, so she should do ghusl and she should pray, but she cannot have intimate relations until the 8 days have passed. Okay, yeah, and she should do a precautionary ghusl on the 8th, just in case if anything uh, does return later on. Okay, excellent, well done. Moving on to the next case study, inshallah. So Tahira is supposed to come on from the 3rd of January to the 11th of January for 8 days. She bleeds until the 14th of January. How many days has she bled in total? So if you could work that out for me. Yes, she's bled for 11 days in total. So what is she going to do now? What is she going to classify as her habit? Are we going to say all 10 days are her period? She will take 8 days as her. She will take 8 days as per her habit, because remember she has a previous habit, and then the rest are going to be istihada. Excellent, well done. Okay, excellent. Jazakallah khairan. Moving on then. Okay, so now just touching on the 10-15 rule. So you've all understood, alhamdulillah, about the habits. So usually when women bleed within the minimum 15-day purity, we know, most women know that they need to continue with salah because they've not had a maximum number of pure days. But what we find quite often is that once the 15 days are completed, they then start considering day 16. So let's say, for example, she started spotting on the 14th day. She'll still pray on the 14th day of purity. She'll still pray on the 15th day of purity. But on the 16th day, she starts applying the 10-15 rule, okay? Meaning that she'll think, okay, 15 days are passed now. Now I have to consider this bleeding as her menstruation. This is incorrect, okay? As you know, because if you have a habit, if you have an established habit in purity and if you have an established habit in haid, then you are going to follow that established habit, okay? So unless her habit is that it's 15 days, she's not going to stop praying. She's going to assess and understand her habit. She's going to assess where her haid is expected to start as per her habit, and she may need to wait until her habit in purity is completed before regarding the bleeding as menstruation, which you're going to understand from the next slide. So moving on to the next slide, which discusses the early blood ruling. So looking at the chart on the next slide. So early bleeding, okay? So if she's now going to assess that if her early bleeding days plus where her haid is supposed to start are equal more than 10 days, then in that early bleeding, she's going to pray, continue to pray until she reaches her expected haid date. But if she assesses and notices that the early bleeding days plus the days of her haid habit equals to less than the 10 days, then she's going to stop praying the salah, okay? Which I'm going to show on a actual calendar. So if we go to the next slide, moving on. The reason between the two differences is that there's a possibility that the early bleeding may be ruled as menstruation or irregular bleeding. So there's a doubt here now that it might be that the early bleeding could be haid or it could be istihada. So in matters of worship, we need to take precaution. So meaning that she will continue to pray salah if it's going to all go over 8 days. But and similarly, out of precaution, she's also going to refrain from intimacy as well. So meaning that although when she's calculating that it's going to go over 10 days and she's continuing to pray her salah, but at the same time she can't have intimate relations with her spouse because there's a possibility that it may not go over 10 days. So therefore she can't have intimate relations, but she should continue to pray her salah. Okay, which becomes clearer inshallah on the next slide, which is the calendar. So you see that Saima's expected period date is the 25th of January here. Okay, we've written down expected start date. She has a habit of bleeding for 6 days, and this month she starts spotting on the 19th of January, which is here. Okay, now the 19th of January is a total of how many days earlier? I want you all to work this out. 6 days earlier. Now, if we add her 6 days early bleeding to her habitual 6 days of menstruation, it makes a total of 12 days. So now, what is Saima going to do? Is she going to continue praying Salah? Or is she going to stop praying Salah? Saima is going to continue to pray Salah up until the 25th, but then after the 25th, if she's still bleeding, then she will stop praying Salah. But she needs to stop having intimate relations with her spouse after this time as well, because there's a possibility that her period may end. Okay, so right now we would consider her bleeding from the 19th before the 25th as istihada, but that may change depending on what happens further on down the line. Okay, so continuing on to the next case study, inshallah. So we have this next case study where Tahira's expected period date is the 6th of January, as we mentioned here. She has a habit of bleeding for 7 days. This month she starts bleeding on the 4th of January, which is how many days earlier? 2 days earlier. Excellent. So should she stop praying Salah as her period has started early? So if we add the 2 early days to her usual 7 days, that makes a total of 9 days, and she's going to stop praying her Salah. Okay, and there's a possibility that her habit may change. So she is going to stop praying her Salah and classify it as hayd from here. Obviously, if things continue more and go over 10 days, then we start needing to look at a place and number, etc. But that is going into a lot of detail. But today, alhamdulillah, I just wanted to cover the brief explanation of this. Okay, so could you briefly explain this ruling again, please? I'm confused. Okay, so when we start bleeding earlier than our expected date of period, which is why it's really important for us to record our habits, because we can work out when we are expected to start our period. If we start bleeding earlier than our expected date of period, and we calculate the number of days that we have in our habit plus the early days that we have started bleeding, if it is amounting to more than 10 days, then the early days you're still going to continue to pray your salah even though you are bleeding, and wait until your expected start date for your period. If the number of days calculated with the early bleeding and where you're supposed to bleed is less than 10 days, then you'll stop praying right from the beginning. Okay, and then obviously later on, if things change, then you would look at it again. Okay, so just the last few slides that we are going to cover now with regards to the prohibitions during Hayd and Nifas, which we touched upon anyway. As you all aware, that we can't pray Salah, we can't keep our fasts, we cannot pray Quran verbally as well as touching the Quran. We are not able to enter a masjid into the actual the Salah, congregational Salah area. So the foyers, etc., where it's not the considered as a musalla area, you can enter those, but the actual musalla area, you're not allowed to enter that.
You're not allowed to do tawaf around the Kaaba, and intimacy with the spouse is also prohibited during those particular times. You can go to the graveyard, G, okay? But obviously taking into consideration all other aspects of, not going at a busy time, etc., and appropriately dressed and not crying and wailing, etc. Okay, so moving on to the last couple of slides now. So, are there any prohibitions during istihada? During istihada, generally, no. You can continue to do all of the things that we have mentioned below, but remember the exception was with regards to intimacy with your spouse if you are when you are early bleeding. So the when the early bleeding is occurring and you are continuing to pray your salah during that istihada time, as a precaution, you are avoiding intimate relations because of the possibility of it being considered um, uh, haze. Okay. Um, okay. So let's just complete the last slide, and then I will take a look at your questions in there. So ending of hayd and nifas, which is something that somebody had also asked earlier, that hayd and nifas will be considered as ended when bleeding stops, so meaning that you see no blood, no discharge is seen, or discharge is white or clear when wet. So especially for hayd, a lot of women, sometimes it tapers off, and then remember I mentioned that it comes to a time where it's going to be an infertile time. And sometimes some women will see no discharge at all during that particular time. So if there's no discharge seen, um, and you're sure that you've finished, you wait until the mustahab time of that salah, and then you would do your ghusl and you would start praying. If after that you happen to see discolored discharge, then obviously you would need to wait until it's clear and then remake your ghusl and pray. Okay. But when you're sure that there's no more discharge now and you're clean, then you should take your ghusl. When I say mustahab time of salah, I mean that, let's say, for example, if you finished asr time, you wait until there's enough time for you to be able to do your ghusl and to be able to pray your salah out of the makruh time. And once when you've checked at that time and it's clear, then you would do your ghusl and you would start praying your salah. Okay. Or your hayd or nifas will be considered ended when the maximum number of days have been completed, which is 10 days for hayd and 40 days for nifas. So at the completion of 240 hours for hayd, you would take your ghusl, even though you may still be bleeding, and you would start praying salah. And likewise for nifas as well. Okay. And you will be considered as pure because obviously you've reached the maximum limit there. Okay. So that is the completion of all the details with regards to what we needed to cover today. There's some common questions I want to go over as well, inshallah. So a lot of women ask with regards to blood which they see after a smear test. When you have a smear test, you also need to take into consideration your habits, etc. So if you've got a regular habit and you have your smear test after the 15 days of purity, but it's before your expected date of period, you're going to look at the early blood ruling that we just discussed. And if it's, the number of days before the expected period and plus the number of days of your period exposed to more than 10, then you'll continue to pray and disregard the bleeding that you saw after your smear tests. Okay, so I think it's all about, you know, calculating and working out when you should take a smear test to be able to help you work these things out as well. Yeah, so it's clever planning, I think, that needs to take place. Another question we have is that, can I just take my ghusl at my habit date if I'm sure I will go over 10 days and start praying salah, which is something that which we covered, that you have to wait until the maximum until that has passed, and then you can take the bath ghusl, and then obviously you'd work out retrospectively. I know a lot of women, they say that, you know, my salah becoming qada, will I be sinful for it? That some of these things are out of our control. It's qadar Allah. So, you know, we wait until we reach the maximum, and then if we have to make qada, we're not sinful for it. Um, it's something which is beyond our control. Okay. Um, there's just two more questions on the next slide, and then I'll look at the questions that we've got in the chat box, inshallah. So moving on to the next slide. So what is the ruling on bleeding due to birth control pills or coil implanted, which is a very common question nowadays we get asked. Again, this is going to be based on whether the bleeding is occurring in the place of habit or not. Again, birth control pills and coil implanted, you're still taking into consideration your habits. So that's why if you are deciding to go on these particular things, do make sure that you have worked out your habits for purity and for your menstruation before you go on these birth control pills or have the coil implanted. So if there is any irregular bleeding, then you can refer back to those habits. So that's why recording is very, very important, and clever planning as well, as I mentioned. Okay. And another common question we get is that if you're out and about and your underwear becomes dirty with discharge, can I still pray my salah? I always recommend to young girls that try and wear panty liners, try and keep some spare with you in the case where unfortunately your underwear did become soiled. Then we're looking at that if the impurity is smaller than the concave of one's palm. So concave of one palm is if you make like a if you put your palm and you were to put some water in there in the middle of your palm, it would be that little area where your palm would be able to hold that water. That is what is considered the concave of your palm. Okay, yeah, like almost like a 50p coin. Okay, not 5p, 50p. 5p is quite small. Okay. So the prayer will be valid but disliked. So obviously you should try and remove it, remove the impurity as much as you can, or keep fresh liners so that you can change regularly. Okay. So let's go to the questions in the chat box, inshallah. Apologies, I know we've gone over, but inshallah, let me have a quick look at these questions. Okay, if you can do zikr, somebody was mentioning with regards to zikr, yes, tasbihat, zikr, etc. can be done during your periods. If you started your period early or on time, but you didn't feel anything and only noticed when you went to relieve yourself, what would you put down as your starting time, as you were not aware when you came on in the first place? It's from when you saw it. So if you didn't feel it and you didn't know, and then from the moment that you saw it, that's when you count as your start time. Do you have to make up these prayers that have been missed? The ones that have been missed due to istihada, yes, you would make those up. Okay. If someone sees normal red blood in her period days and towards the end of her period days sees yellow discharge, which she sees outside her period days, when has she officially stopped her period? Okay, so based on your habit, if there's yellow discharge in the days of your habitual period days, so let's say for example your period days are 7 and within those 7 days you see yellow discharge, it'll still be considered as haid, because remember yellow is considered as haid. But outside of your regular habit days, then that's just your normal discharge that you are experiencing. Okay. Do you wait for a full salah time to pass to determine if you have finished? No, not necessarily. We mentioned that with regards to waiting until the mustahab time where you can pray, and then you would do your ghusl and you would start praying. If you have missed a salah which you should have read, but your ghusl time went over that salah period, would you make up that salah you missed? Yes, you would, because if you would have had enough time, then you should make up the qada. Okay. Let's see, we've got a woman has a habit of 5 days. She sees white discharge on the 6th day, then on the 7th day sees blood and stops. So is her habit 7 days or still 5 days? Her habit will be 7 days. because she's seen bleeding again, and it's all under the 10 days. So that will be added on to the days of bleeding. Do we have to wait for 40 days to start salah after C-section, even though the bleeding has stopped early? No, you don't have to stop. You don't have to wait until a maximum 40 days after a C-section. So if your bleeding stops in nifas early, then you should take a ghusl and start praying. If you happen to see colored discharge again or more bleeding again, obviously you would stop again. But as soon as you feel like you're sure that you have stopped, then you should stop. Okay. How long do you wait to see if menstrual bleeding has stopped? On the last couple of days of a cycle, if a woman has a really light flow of blood, should she wait 24 hours from when the blood is seen and then perform ghusl? No. So this is when applying a kursuf is really important, because um, if you put the tissue at the vaginal opening, when you go to the toilet, you'll see that is colored, even though it might be slightly discolored, but you'll see that that is still colored. So you know you're still on your haid. Until you don't see clear or white, then you know that you're still on, but not necessarily 24 hours, because 24 hours is a very long time. Okay. We specified the concave of the palm. Do we need to make fresh wudu? And if there is some reason such as travel, work, and do the salah, is it valid? I'm assuming you're talking about discharge. If the discharge had come out, remember we said that it would nullify the wudu, so then you would need to remake wudu. And then obviously we talked about the methods of you stopping that from coming out. Okay, for somebody who has PCOS, it would depend on whether you have always suffered from PCOS. Some girls, right from the very beginning, they have this irregular, erratic periods. If it is right from the beginning, then they're going to follow the 10 days haid and 20 days purity rule. If it is something that sometimes it occurs for some women later on in their life, they would have to refer back to their last valid habit, which is why it's really important to keep diaries. And especially now, alhamdulillah, with apps, you can probably keep years worth of habits on there and refer back to the habit. Really, for somebody who's suffering from PCOS, they need to go and contact an expert and discuss that with them and have a look. I can't give a blanket ruling, because for each PCOS case it is quite different. Some women do sometimes have a habit within the irregular erratic bleeding, which then they can refer to. Okay. So I hope that answers that question. What amount of discharge would need to exit a woman's vagina for the wudu to be invalid and repeat? Even a small amount, remember, even a droplet of urine causes a wudu to become nullified. So likewise with discharge as well. Sometimes when checking, there can be a very small amount of discharge, but because you have checked and discharge has moved from the vaginal lips, does wudu break even though it's a small amount? Yes, I think I've covered that. It does. We've covered. Does any of this apply to when a woman has polycystic ovarian syndrome and is on daily pill to stop bleeding altogether due to non-stop bleeding if on pill, but still has spotting or a slight pinkish bleed every few weeks for a day or so? Please advise. Again, in that particular case, you would have to refer back to habits or see if there's a habit that can be established. That's why it's very, very important to keep records. I can't stress how important it is to keep accurate records. Can you still recite on your baby while on your period? Is there an exception? Recite on your baby if you are praying those Quranic ayat which are recited for dua purposes with the intention of dua, you can recite those. But those Quranic ayat which are mainly for tilawat and read with the intention of tilawat are not permissible for you to read. Okay, on your period or on your nifas. If she knows she has discharge but she has an issue there to block it regardless of the amount of discharge that is there, would the wudu be valid? Again, you're now talking about taking the lenient opinion of regarding the discharge to be considered as pure. Again, that is on a case-by-case basis. Definitely when it's through the ovulation time and it's definitely coming from the cervix, that would break. But in the other days, she may take the lenient opinion. But again, you should speak to somebody in regards to that on your particular case to ascertain that. If it's uncertain, means every month are different, then what to do? Uncertainty in periods, I'm assuming. Um, again, if you've got accurate records, you'd be able to follow some sort of habit. Okay. If someone is going for Umrah and takes pills to stop bleeding, and then during the days she is supposed to be on her period, she sees only a little bit of blood on wiping, will she be classed as on her period and cannot do tawaf and enter masjid? Is it possible to keep a cloth or tissue in the area to stop it coming out? Okay, so if you're going for Umrah and you're planning on taking the pills to stop the bleeding, and if you see spotting during the days when you're supposed to be on your period, and if it is the required amount to be considered as haid, then it will be haid. Unfortunately, you will not be able to go into the masjid and you will not be able to do tawaf and pray salah. Okay. In respect of keeping a cloth or tissue in the area to stop it coming out, that would be the case of if you felt like you were in Umrah, you had put your ihram on and you were worried that you're going to start your period and you blocked it so it gives you enough time to perform your Umrah, that would be fine. But if it's already come out, then it's considered as you've started your period. You can't block it after you've already seen it. Okay, so you can block before it even comes out, but not after seeing it. Can one do the blocking method after wudu, or do I have to do it beforehand? So you generally go to the toilet and clean yourself beforehand, and then you'd block it. Yeah, and then you'd make your wudu, then your wudu would stay intact. What does one do if they don't remember the exact nifas habit of their first birth? What do I do for my future nifas? Try and calculate it. Yeah, because if it goes over 40, then you need to refer back to your habit. So that's why it's really important to record it, inshallah. If you don't have a habit of tuhur days, would you just count maximum 15 days to determine when your next period starts? Not necessarily. There's a lot of factors that need to be taken into account. So that would be a detailed answer. So you would have to contact somebody directly in terms of that. If after a woman's waters break, she began bleeding, is in labor, is she required to pray? Yes, she is required to pray until more than half of the baby comes out, even though she is experiencing waters or there may be blood, etc. She should try and make wudu and pray. She doesn't necessarily have to stand up and pray. She can sit down and pray. If she's finding it really difficult to do wudu, then there's also the option of tayammum and then making qada later. Does one need to pray qaza for her period? No. Any salah missed whilst you're on your haid, you do not need to make qaza of those. Any salah which are missed because of istihada, when you work it out, then you would make qaza for those. Okay. When someone is coming towards menopause age, so hasn't seen period for a year, then sees period, would you class this as period? When to officially say she has reached menopause? Okay, so official menopause, remember the age was 55 lunar years. If she hasn't seen period for a year and then she sees period and she's seeing normal colors that she would see in her period, then it would be classified as a period. So it would be continuous as period. Even after the age of 55, if she sees bleeding that is on par with what she used to see when she's on her period, there is also a possibility of classifying that as period as well. Okay, based on other factors as well that need to be taken into consideration. Probably an obvious question, but if your discharge touches your clothing, does it become impure to pray in that clothing? Yes, it becomes impure. Try and wash it. Obviously, if it's a small amount and you are unable to wash it, then it's maaf. Remember, that comes back all to the rulings with regards to purity and clothing, which I don't have time to go through, unfortunately, right now. But if it's a large amount, then yes, you do need to purify it. If you bleed for one day and the bleeding stops, should you wait a certain amount of time before praying again? No. If you bleed for one day, and let's say, for example, if you start and then you see nothing, then you should within the 3 days, you only need to make wudu and start praying again. So let's say, for example, if I saw some spotting at 3 p.m. today and then later at Maghrib time, there's nothing, then I just need to make wudu and continue praying my salah. So within the 3 days, it's just wudu and continue to pray salah. After the 3 days, if it stops, then you need to make ghusl and then pray your salah. Okay? So I hope that answers that. Water breaks in pregnancy, wudu breaks, yes, because waters are considered impure. Why can you not recite on your period? Because we have been told it's a prohibition. Allah subhanahu wa ta'ala has mentioned in the Quran as well, that we cannot recite the Quran when we are in an impure state. Okay. Yes, you can wash off. Washing off with water is ample um, in order to wash off the dirt. Can you read manzil or du'as of protection such as Ayatul Kursi in menses? Yes, you can read manzil and Ayatul Kursi, because these are also like du'as. So with the intention of du'as, you can pray those. Um, Ameen to your du'as, mashallah.